Hi, my name is Ritu Shah, and this is my presentation for the discussion for Technology Show and Tell. My topic for today is airway clearance techniques and respiratory muscle training. The techniques I'm going to expand on are autogenic drainage, and the devices or tools I'm going to expand on are mostly a cappella and other RMT devices that help in clearing of the airways. So, airway clearance is not just breathing exercises, it's a whole process and it's scientifically backed. It's a physical therapy technique which is used in patients with COPD, bronchiectasis, cystic fibrosis, neurological patients, and even post COVID. And the two major goals that are supposed to be achieved in autogenic drainage and airway clearance is to mobilize the mucus, which means to move it from the places where the mucus is stuck and to improve the airway patency. The patency means the potential of gases and especially oxygen in the air present inside the lungs. And the second goal is to strengthen the respiratory pump, which is the muscles. And breathing is a skill, airway clearance is a technique, and RMT is strength training. So we're going to cover autogenic drainage, which is controlled airflow. You breathe on different volumes of air on different lung volumes, and we're going to cover more of a cappella device and a little bit of introduction for the other devices. So airway clearance is secretion mobilization, then airflow improvement is improved patency, and then we move on to RMD, which is increased strength. So these are the three steps that helps us improve the overall patient's breathing capacity. First, we clear the airways, and then we improve the airflow. And then, after both of those steps are done, we increase the strength to prevent the formation of mucus and to prevent shortness of breath. What is autogenic drainage? Autogenic drainage is a manual technique which uses airflow and lung volume targeting. So it doesn't need any device, it's purely skill based, it's very easy. And the best part is that you can access it, you can use it in any part of the world. You don't need any high tech gadgets. So, this is why I picked the topic of autogenic drainage, is because it's a very underrated, underused technique in my belief, and you don't need any actual gadget for it. You just need to demonstrate, or you just need a paper to show the patient. It uses the changes in airflow to unstick first, collect, and evacuate the mucus. And it requires body awareness plus coached practice. You sometimes you don't get it in the first go. And it's great for all these conditions: bronchiectasis, CF, post viral congestion, and neuro patients. So there are three phases for autogenic drainage. The first is the unsticking phase, where you breathe on low lung volume. So you take small shallow breaths and it loosens the mucus in the smaller airways and it moves the mucus up to the middle airways. The second is the collecting phase, where you take deeper breaths. So every time you take a longer breath and breathe in and a shorter breath out. So the second one is control breaths, move the mucus more centrally. So the first one was you move it from the bronchioles up to the major bronchus. And then in the third phase is the evacuating phase. So you breathe on high lung volumes, you take deep breaths and you take deep breaths in and shorter breaths out. And at the end, when you feel the mucus move up to the top of your airways, which is the larger airways, the trachea, you take one or two huffs. Huff is a little bit different from cough. In when we cough, the epiglottis is closed, but when we huff, the epiglottis is open, and it's more effective to release the sputum. And once the cough is out, we can repeat the whole cycle again. So implementing this technique into a device is a cappella PEP device. So the oscillations shake the mucus loose and the positive expiratory pressure keeps the airways open for the mucus to come out. And this is much easier to use with pediatric and geriatric population because it is more difficult for them to understand and practice autogenic drainage method. And this works on the same principle, works on any position as well. How it works is you have to inhale normally and exhale into the a cappella device, and the valve that you see over there near the ball, it creates oscillations and vibrations, and due to this the positive expiratory pressure will open up the airways and let the mucus come out, and then you have to huff and cough to clear the secretions and use it again. Now, RMT is a very interesting topic because it is like resistance training, but for the lungs instead of the other muscles. What we do in the gym for our hand and leg and back muscles, we do with respiratory muscle training, and it strengthens the inspiratory and expiratory muscles. It helps with dyspnea, endurance, and post-COVID fatigue. Basically, it adds resistance to breathing in. So a cappella was about breathing out, but this is about breathing in. So it adds resistance and you have to put a load on the respiratory muscles to take in the air. The mechanism is that it's resistive loading and it activates the diaphragm, which is the inhaling muscle, and it improves the maximum inspiratory and expiratory pressures, increases the cuff strength, which is the most important for airway clearance since we have to cough to excrete the mucus. And we usually use a cappella or the autogenic drainage first, and then we use RMT later to strengthen. Like every technique or technology, it has its own strengths versus limitations. The strengths for airway clearance techniques is its low cost and it's very effective, and it can be taught very quickly and it can be taught remotely as well. It's great for home programs and it is evidence based. All of this is backed by science. The limitations are that autogenic drainage requires practice and coaching. You can't get it right on the first time itself. And a cappella technique is dependent on the tool, and some devices are not standardized, so all the brands might differ and it might not work the same. In conclusion, airway clearance techniques plus RMT is a powerful combination. I picked this topic because it's not flashy technology, it's not very well known, and it doesn't require a lot of gadgets, but it's extremely effective and it helps patients to breathe easier and to breathe free and to recover faster. So breathing is just not automatic. Breathing comes natural to people and it's automatic. But with the right tools, with the right techniques, it can even be therapeutic. It can even help the patient heal faster. Another thing that I wanted to convey was that sometimes autogenic drainage is done ineffectively, and it might be due to the teaching methods and it differs from language to language. But to make it more effective, you can just take a piece of paper or piece of newspaper in front of the patient And you can first, for the first lower lung volume, you keep the paper close to their mouth and you tell them to blow lightly. You just have to move the paper. So if it moves, that's the right one. Then you take it farther away and then you tell them to blow a little bit more forcefully in order to move the paper. And then for the higher lung volumes, you tell them to forcefully blow with the objective of moving the paper completely away. And that's how you achieve the higher lung volumes. And this is an easy method to make the patients who are not very well educated also understand what we are saying. And then you teach them how to huff, which cough is like that, and a huff is like, you can even tell them it's as if you're blowing air on the glasses, like that. So that's exactly what a huff is, but a little bit more forceful. And these methods are it's a brilliant technique developed in the physical therapy field to help the patients achieve airway clearance more effectively. And I think it makes a lot of difference in patients with post-COVID congestion and chest congestion and mucus in the airways. So I think this is a technology that I wanted to educate my peers about. Thank you.